Very interesting. Candid conversations. My name is Ian Neita from the Jamaica Chamber of Commerce, and my co-host today is Arlene Martin from ActionCOACH, and
Hello, everyone.
And we're delighted to bring to you another very interesting series of Candid Conversations. Today we have with us from Partners International Center of Jamaica, we have Dr. Victor Elliot, who is the managing director, and he's also a consultant cardiologist at the University of the West Indies. We also have Heather Mckoy, business manager with Partners International Center of Jamaica. And today we're going to be talking the subject of the heart, mainly. So I want to just thank you for leaving, I'm sure, maybe the bedside of some of your patients, and I know you are very busy. So we thank you for joining us today so that we can have this conversation, because you run a center of excellence, and it's for us to spread this word about what you do. So hopefully we can have that conversation today. But because of the season we're in, from a health standpoint, I want to start out by asking you, are Jamaicans a lot more stressed? Are our blood pressures gone up because of COVID? What are you seeing?
Yes, we are seeing that in some ways they're a lot more stressed, especially psychologically. But we are seeing effects on the heart, their blood pressures, and their diabetes control. So it really is an issue in more ways than one, absolutely. So it's mental right across the physical realm, psychological, emotional. It is a health issue, and you hear they keep talking about it all over. So, and especially if any of you have had to deal with homeschooling, that too is another stress, which I'm sure the parents know about between the kids and yourself.
Of course. Yeah. So how well are you positioned to address this increased stress? What do you do for us?
When it comes to the cardiovascular aspect of it, we are very well positioned in helping our patients manage their blood pressures, the changes in their diabetes, any changes in the heart, because we do see them, they do come. And we have to really encourage the patients to try and control these, especially in the COVID time, because we have realized that high blood pressure and COVID do not go hand in hand at all. It's almost worse than some of the other conditions. So you'll hear a person even with asthma who gets COVID who does well, but a person with high blood pressure, if the pressure is not controlled, and COVID, they don't do well at all. So, but we are well positioned, and once the patients come, we have an active team, not just deal with, say, pushing medication. We're talking about lifestyle. We can deal with diet. We can have a pharmacist talk to them about their medication. You have our nurses who can counsel them. So we are very well positioned.
Okay. And Heather, what are some of the services that you offer that we can look out for?
Good afternoon, everybody. Well, first of all, because we're a cardiovascular center, we do everything that pertains to the heart. So we have our diagnostic procedures, echoes, ECGs, blood pressure monitoring, and so on. We also do cath procedures, angiograms, angioplasty, implantation, and we do the follow-up with the patients where we do the pacemaker interrogation. Those are the main services that we offer. We also have an in-house general physician who she can take care of your non-cardiac needs. And we also have a dietitian on our team who is able to walk you through different lifestyle changes and your diet and so on. Dr. Elliot also mentioned our clinical pharmacist, who we find is very essential for some of our, especially our older patients, who have to take multiple medications. So she can sit with them and, give them advice and so on about the medication that they're taking. So we're pretty much a full service cardiovascular center.
Okay.
Okay, and you know,
Okay, thank you
Doctor,
so much for that.
okay, go ahead, Arlene.
Yeah, one of the things I was wondering is with the, yes, we are experiencing a little delay with COVID-19. Medical facilities have had to respond, probably managing the intake of persons only critical, or just changing schedules. How much has it impacted the delivery of your services, and has it been skewed to a particular area more so than the others?
I'll go first, and then Dr. Elliot can pitch in. When COVID just started in March of 2020, I mean, it seems so long ago, but yes, we had a complete downturn of patients, especially because older patients were asked not to come out. They're asked to stay home, and for our demographic, a lot of our patients are 60 and older. So we immediately saw the impact of that. As it continued, though, the curfew our staff tremendously. Most of our staff live out of Kingston, so that had a tremendous impact. So it meant adjusting schedules, closing earlier to facilitate them getting home on time, and some of those issues. Everything started picking up back, and as I say, outside opened up a little bit, we tended to find a lot of persons coming in to do procedures like ECGs, echoes, but not really wanting to do major procedures. They were a little bit scared of that. We immediately had to be calling persons to reassure them it's still okay to come. Wear your mask. When you come, we'll help you to sanitize and take your temperature and so on. So we almost had to be coaxing our patients to come back out and to encourage them to know that they would be in a safe space.
So then you had not proactively limited the delivery of any services. You were still open and are still open for the provision of all of your services.
So we're a unique cardiovascular center because we're located on the second floor of Medical Associates Hospital. The hospital can't close, and because we're supporting the hospital, we had to make sure that we were open as well. So even though we had to adjust our schedule, adjust our staff, there was just no thought of us closing at all. What we did do is to try, and some Saturdays we were not open, just to allow our staff time to do their shopping and their sanitization at home, because that was also important, and to make sure that the stress of work and home wasn't impacting them emotionally or physically.
Okay. So just a follow up on that. You have such sophisticated procedures and equipment and so forth. What is your client base like? Are you able to? Is it affordable for the ordinary Jamaican? Are your services affordable to the ordinary Jamaican?
That's a very good question. I would say that we are competitively positioned. To facilities that offer similar types of the major services that we carry in ours, and they also do pacemaker implantation. What I didn't mention is, so we try and make those within the range of what the other persons charge. We do try to work with persons who are financially challenged. We encourage them to get support through the Compassionate Fund that's offered by the Ministry of Health. We also still have our partnership going with Ready Cash at Court for those persons who are able to take up that offer. And where we can, we really work with the caregivers, the families, and the patients to make sure that if it, for critical cases, that they're not denied in any way. So that answers the affordability issue. What I didn't mention is that we do have some unique services that are only offered by one other facility. So our EP studies, electrophysiology studies, which is also offered at another facility, I would say is one of the most expensive procedure. So that one, we really have had challenges assisting persons with that, because in some cases it's such a necessity. But again, we do work with the families and we do our best to make sure that we don't turn people away because of that. But of course, it's challenging for us. We're not a financial institution and we're not at the level where we can, offer any financial aid or anything like that. But believe me that we do our best.
Okay, thanks.
That's encouraging. That's very encouraging. Dr. Elliot, you spoke earlier about, our lifestyle habits and what we can do to preserve the health of our heart. How much of negative heart conditions are as a result of, hereditary factors versus lifestyle factors?
Well, believe it or not, there's a big overlap with both of those. When people think hereditary factors, they think a lot of times of a particular rare or unusual disease that they inherit, like cystic fibrosis or things like that. But our two most prominent diseases, high blood pressure and diabetes, runs a lot in families. And we realize there seem to be some hereditary aspects of that. Also elevated cholesterol levels. So if you include those, it does play a very big role, even though you'll find persons who have it with no family history. So if you include those, it's a big factor, especially the hypertensive factor. That is a very big factor when it comes to heart disease and stroke. And so in addressing that, we can therefore address a whole multitude of sins, as I like to call it. Because if I just take a minute to just talk a little about high blood pressure, because people tend to ignore it, not understanding exactly how essential it is. And let me just kind of give an example. A person who has high blood pressure and is not controlled, that high blood pressure, say, cause them to have a stroke.
Yeah.
So they have a stroke, which causes them to have weakness on the left side. That is fine. So they recover from that and they spend years walking with that weakness on the left side. But one day, because of that weakness, they actually fall. And so they fracture their leg. They get hospitalized with the fracture, and in the hospitalization, they develop a clot in the leg, which moves up to the lungs, causing a condition called a pulmonary embolism, and they die from that. And so on the death certificate, they put death by pulmonary embolism. But who started all of this? Hypertension. And I can tell you, a lot of the patients we have who get admitted with pneumonia and sometimes GI bleeds and so on, if you actually connect the dots, hypertension was the guy who started a process that led to another condition, that led to another condition that caused their hospitalization or their demise. So I consider high blood pressure as the don behind the gang who nobody can find. Everybody sees the front man. Everybody knows little One-Eye Joe who carrying pistol. But who gives One-Eye Joe the commands? The police can never seem to find that person, and it's always hypertension in many cases. So it's a big issue, especially when it comes to heart disease. It's a massive issue. So I just use this just to promote that if we can control high blood pressure, if we can get our patients to control their blood pressures, I can tell you at least 25% of the medical problems and admissions, if not more, would be erased.
Okay, may I just ask you, what else should we pay attention to? So, you have that done, as you call it, the high blood pressure, but there are other things, and you had mentioned high cholesterol earlier, which, you do have a number of people with that issue, myself included, and you don't realize, so when you first told about it, they're not giving you the possible consequences about it. So what else would you caution people to be aware of and to monitor early? So high blood pressure, what are the other things that people need to be careful about so that you don't get to that stage where we need a serious service from you rather than, one of the preliminary ones?
Yes, and that is a good question, because while we do treat condition, preventive cardiology, as I like to call it, it's a big role of what we do. So apart from high blood pressure, you mentioned the cholesterol. Let's start there. Now, high cholesterol puts you at risk of blockages of the blood vessel, which can affect the heart, put you at risk of things like a heart attack. For the brain, put you at risk of having a stroke. For your legs, risk of poor circulation. What some people don't realize, it can affect your blood supply to the, and so you have problems with the intestines, the digestive system, and sometimes the cause of severe abdominal pain. Sorry. And so if we keep those levels down, it's not in a week or two. You talk about the next 5 years, 10 years, reducing your risk of an event occurring. Diabetes is another big factor.
Wow.
I consider diabetes and hypertension like Bonnie and Clyde. When you put both of them together, they just go out and they cause mayhem. And diabetes, again, in a lot of respects, is controllable. Unlike with blood pressure, like blood pressure, a lot of people will have it for months or years without realizing they haven't gotten checked. And by the time they find out, a lot of the damage is already done. It's like you have that nice furniture in your house, your in Jamaica, it's a wax it not. And it's there, a nice piece of wood and so on. And one day you put upon it or something and you see it break and realize you have termites. So by the time you discover it, the damage is already done. You can't reverse the damage the termites have done. So on the outside, it looks good, but the inside is now damaged. And that's what high blood pressure and diabetes does if you don't check for it. And that's why we encourage the annual checks on your sugar, your pressure, your cholesterol, so that once discovered, we can control to prevent the damage that will occur 5, 10 years from now. We definitely have to talk against smoking. It's not a disease, it's a habit, it's a lifestyle habit. And it is the most reversible, preventable, whichever phrase you want to use, lifestyle change that can reverse a lot of disease conditions. You stop smoking, you reduce your risk of lung disease, you reduce your risk of heart disease, you reduce your risk of over 10 different types of cancers, etc. Diet and exercise. Now, this is the hardest one. The average person perhaps has joined her gym about 5 times and attend none today. And so, and that's the reality, because it's a hard thing to start and to maintain and proper eating. But if we don't do it for ourselves, let's get our children started in that type of lifestyle, so that when they grow up, it's the way they know. For us, it's hard to change. Let's make it their lifestyle. Let's make it their norm. But even for us, any change in reducing the amount of processed carbohydrate, fat, fatty food, oils, reducing those and increasing our plant-based type product, not the vegetables and etc., especially vegetables. I keep giving the example of when you go out on the street and buy a box lunch with the 2 pieces of fried chicken and it's filled with rice and a little handful of shredded cabbage and lettuce. It really should be the other way around. It should be filled with the lettuce, the cabbage, the cucumber, and the 1 scoop of rice. And that is how the diet really should be. Unfortunately, sometimes vegetables end up being more expensive. So it becomes difficult. But there are different ways, and that's why we love our dietitian. She helps to work with you to find ways within your means to make this happen. So it's we could spend the whole time just talking on this, but realize the best example, if you get your annual checks, if you're found to have a problem, work with your doctor to control those factors. And I know people don't like taking pills, But here's one thing: the 2 pills you have to take to control your blood pressure is different from the 10 pills you would have to be on if the pressure that damages your kidneys and you have kidney failure and you have to be on dialysis.
Oh, that's a good
Doctor,
point.
I think you have sufficiently scared us.
Yes, yes. I can confirm that.
We have, because I have noticed over the last few years where I just think Jamaicans are getting out there more. I hear about a lot more 5Ks.
Yes.
I see people jogging all over the place. I also believe that the ban on smoking in public places, I think it is working. I think it's now a taboo. I don't go out and see people just lighting up anymore. So I just wonder if we have seen any of the impact of some of these legislation or life-changing habits. And what is it that you think the government and us private sector can do more of in terms of education, in terms of outreach? Is it, what are your views on that?
Wow. Okay, first, we are seeing the impact of that, and we are very grateful that we live in a society where the government can institute these changes despite the protests that some people had initially, for the government to be able to take the steps, say, look, we are here for the people, and we have to make steps not just for financial adjustments and economy, but also for health. And we're very much appreciative of that. So yes, we're seeing it. Some of it we're not going to see the full effect in maybe another 5-10 years, but that's fine. We will see it. And they ban in terms of reducing the amount of sugary drinks that the children have. We will see that effect when they grow up and start to see the decline in the number of persons with diabetes, etc. What is it the private sector can do? Well, one, get on board with like the Heart Foundation, the Jamaica Move. That is important. Or come and work with us. Let's get more initiatives going to try and promote healthy lifestyle, because changing lifestyle is the hardest thing. And if you get the encouragement from all the different angles, it is helpful. And it works out for the private sector. What you have to think about is the economics of this. Now, while in Jamaica, we tend not to do such studies. A lot of studies have been done in a lot of countries on the economics of maintaining a healthy working force. So a person who develops high blood pressure and is not controlled, then they have a heart attack. That time of the heart attack, going in hospital, getting treatment, it's time away from work and productivity. If the heart attack causes them to develop what we call heart failure, that man who you have loading trucks and lifting may find he can no longer do that. So he has to move out of that job to something else or loses a job. The company loses from his productivity. And so there are a lot of studies showing that by keeping that healthy force, the economy of your company benefits. And it also, you end up paying out less over time for insurance. For that group insurance, yes, to keep your premiums down. The other way how we would like to see the private sector help.
I'm curious, have you...
Pardon? The other question?
Go ahead, Dr. Elliot.
Okay.
Yes, no, please go ahead, and then I'll have another question.
Right. The other way how I think the private sector can help, and I've asked about this. Mrs. McCoy mentioned that some of the procedures we do are expensive, but some of them are essential. If a person, and I just explained one of them, which we do, which is called angioplasty, which is opening up a blocked blood vessel that supplies the heart muscle with blood. When a person has a heart attack, that is what happens. A blood vessel gets blocked acutely, the heart muscle stops getting blood, and heart muscle starts to die. And the person ends up with heart failure, and as I said, they're no longer able to be as active as they could. So a treatment is to go in and open up this blockage, and you have a limited time to do this to save the heart muscle. So the patients come to the hospital with a heart attack. They need this procedure, but some patients can't afford it. And so what happens is that person suffers the heart attack, loses the muscle, becomes unproductive. Worse if they are the breadwinner for the family. And so the family loses their breadwinner, and the economy of that family is affected. The girl who wanted to leave high school and go to university is now affected from getting that university education. I would like us to be able to work with the private sector to have some form of, I don't know, initiative, financing also to help those patients without insurance and who do not have it to get this kind of emergency treatment, so that when they come, we can access and help them to pay for this procedure. Because it's not the treatment, it's not cosmetic, it's life-saving. It's production saving, it's economically saving. And so if we have programs like that to help them, so when they come and we assess them economically and we realize this person just doesn't have it, and that's a reality. We need some of them who just don't have it. And yes, we have helped some of them. Don't spread it too much. We have helped a few, and it has come out of our pockets, but it is expensive, and we can't do it for a lot of people or for everybody. But if there was a way, some funds, some initiative, this person gets the help, especially in the emergency type setting. And we've seen it sometimes. I've had patients who come in, that little man who loads the truck, for example. I can think of a particular company. I'd even call it just for a little 1 minute promotion, Burger Paint. And they stepped in for that person. And the company said, we will pay for that worker. A little worker, not the big time manager, but they saw the benefit and the person benefited from it. So if we have more initiative, but a more formalized one, I think it will go a long way in improving the economy of the patients and of your own companies.
Great.
Okay. Thank you so much for that. Thank you. I wanted to find out, have you started in the area of medical tourism? I'm not sure whether it is that you actively promote your services to non-Jamaicans for persons to come here for your services, or are you providing your services in any other way? I'm not sure if people do major surgery, they need follow-up, and so they can come to Jamaica and you're there to help them through. But have you started that at all in terms of venturing into medical tourism? Because we have the talent, we have the doctors, we have the facilities like yours, and this is Jamaica. Who wouldn't want to come here for certain things rather than being in their own country? So any efforts there as yet?
We haven't started it in a big way. Medical tourism is a little more than just inviting persons to come here to do procedures.
Right.
You have to ensure that your facility has certain standards in place. So I know it is a work in progress that the government and other agencies are trying to make sure that standards are in place to bring us up to par before we're able to go advertising to tourists to come here to do the procedures. We do, however, have some our neighbors in the Caribbean, some of them who don't have a cath lab at their facilities or at their disposal. So we do get a few patients from some of the small islands from time to time who will contact us to do their procedures here. We also have persons who live in the diaspora who prefer to come home to do their procedures just because family is here. So we do a small number. We hope that once the regulations and so on are in place and we can become accredited, that of course we can advertise to do this on a much wider scale.
We have treated tourists who have landed in the island and have gotten into problems. We have treated a ship not planning to come to Jamaica. One of their crew members had a heart attack, and of course they docked in Jamaica, and through the maritime bodies that have had they come here and get their emergency treatment. So we're always here open for them. But yes, formally, there's still a lot of work to be done in that area.
Okay, thank you.
Just a follow-up, Arlene, on that question. Just in matters of the heart, though, how do we rank against
Yes.
other territories around us or in North America? I've been told that if you have big heart issues or brain issues, you should try to get one of those air ambulance. Is that true, or what is our standard like when you on a comparative basis?
Okay, there are many layers to that answer.
Mm-hmm.
You know, what I always like about Jamaica is that we are, and forgive the terms, I really hate the terms, but just understand it. We are a third world country with a first world mentality. In that we always want the best. We want third world standard. We don't look on ourselves that way. So I prefer the term developing and develop, but I use that to just bring out the reality of where we are. Because of that, we have invested a lot into the standard of our healthcare and what we provide. So I've had lecturers, professors, doctors from Europe and the United States who have come here and they're surprised at what we can accomplish with what we have.
Yes.
And because we like that standard. So in ranking compared to the other islands, I think Jamaica, in terms of healthcare standard, we are definitely above most of the other British-speaking islands. And when it comes to cardiac care, I think Trinidad is the only one that is somewhat on par with us. Compared to, say, the whole Caribbean, Dominican Republic, Puerto Rico, I think we are a little behind Dominican Republic. I think they have the best cardiac development in the Caribbean, but we're not that far behind catching up. What we have done at PICG, we have technology involved with some of our procedure, which is not found anywhere else in the island. It does add, unfortunately, to the cost when they are used, but it makes procedures safer, more complete, and a lot more can be done. For example, what we call intravascular ultrasound. We can actually do ultrasounds in the blood vessels and things like that, which a lot of people, which is not available elsewhere. And so it's available in North America and in Europe. So we're kind of unique with that, and we continue to see what other new frontiers we can bring. And so as a result, I've had, yes, as Mr. McCoy mentioned, persons in the diaspora abroad, they have investigated and decided to come and do their procedure out here because they realize it's really not that far off. Actually, we're better than some American hospitals. If you're to look on the individual hospitals, we can't compare to Mayo or to Jackson or Baptist, definitely not. But guess what? We have that first world mentality, and we want a first world type experience for our patients. Whether you are from Cherry Gardens or from Rima or from Tivoli or wherever, we want you to have the experience of your life.
Absolutely, very good.
Thank you.
And Arlene, okay. I like the link you made. Never thought of it the way you put it, Dr. Elliot, about the link between wellness and our economics. You know, it's such an important link. A healthy society is a productive society, is a wealthy society. What does the future look like for PICG? What's the path forward? What's the expansion? What new and different are you going to come with that will make us excited?
Okay, you want to give out trade secrets?
No, within confines.
Okay. As our name says, we are interventional center. And so we're looking to be able to provide procedures which can be done through the pipeline of the blood vessels.
Okay.
So opening up blocked vessels of the heart is just part of it. You have other blood vessels which can get blocked, such as within the legs, and we're working on a program to provide for people with poor circulation to the legs, and that is very important for diabetics. A lot of diabetics lose their legs because of poor circulation. If you can intervene, you see how the economics work out. A procedure which may cost 400,000 can save a person's leg and keep him working for your company for another 5-10 years, keep his income going, keep his family going, and keep your company functioning. Because he's one of those great workers who keeps winning Employee of the Year, and you don't want to lose him or her. But we are looking to always improve the level of cardiac support that we give for our patients. So one of a unique thing that we have, for example, is monitoring of pacemakers from your home. So, and this is very important, like in this COVID time. So a patient who has a pacemaker, an elderly person who doesn't want to leave their house to see if their pacemaker is working well, we have a system called the MyCare Link, in which once they have a smartphone, there's a device which they get from us, which checks the pacemaker, download information to their smartphone, and we get it on our computer system. Again, that's a unique thing that we offer. And it's how helpful that is. So that's new technology which we're always coming out with to make our patients safe and to offer alternatives for their cardiac care, for their monitoring. So there are some things coming up in the pipeline. The electrophysiology studies, which was mentioned, we started providing them from over a year ago, and a few patients who were having problems with racing their heart. Just in case you don't know what it means, electrophysiology has to do with the electrical activity of the heart, which sometimes makes people's heart go very fast and affect their ability even to exercise. But if you can sometimes find the cause, you pass a little catheter into the heart and apply a little burn to the guy that's giving you trouble, so that you no longer have racing of the heart and they're back to normal function. And we have been providing that for over a year, and it has been good. We have had people go back to productive lives because of that. So we have things coming up, but more interventional and also a lot of work on preventive, because I'm a strong believer in preventive cardiology.
Well done. So I mentioned earlier that you scared us, but I think you've also encouraged us and give us a lot of hope about the future and what you do for Jamaica, our economy, our healthcare. This has been a very engaging conversation, very interesting, very enlightening for us and our viewers. So I just really want to thank you, both Dr. Victor Elliot and Heather Mckoy from PICG, and on the great work that you're doing to improve our health and to inform us and to educate us about lifestyle, about things that we can do, and to encourage us to come on board with you. I hope one day that you will be listed on the exchange so that we can be a part of that dream that you have and share in your growth and prosperity.
Thank
you very much.
Looking forward to, actually.
Okay.
Excellent.
So thank you so much. Thank you, Arlene. Once again, it has been a pleasure for the Jamaica Chamber of Commerce to be associated with ActionCOACH, and we look forward to many more of our candid conversations. Thank you all so much.
All right. Thank you very much. Have a great day.
Thank you very much.
Thank you. Bye-bye.